Smart Chiropractor Show. It is April 5th, 2022. Believe it or not, it is spring, and we are going to revisit a presentation from Axis 2021. Axis was our clinical online event. Stay tuned for details around Axis 2022 coming up shortly. We had a fantastic lineup for Axis 2021, including this presentation by Dr. Michael Longyear. He started this out, tough word here. Dysmetria of movement and thought. I think I got that 100% correct, but we're going to tune in to the beginning of Dr. Longyear's presentation. He is a professor at Life University. This presentation was a highlight of Axis 2021. We'll give you a little taste on today's Smart Chiropractor Show.
Hey guys, welcome back to the Axis Chiropractic Clinical Care Summit. My name is Dr. Michael Longyear, and I'm going to share some things with you today, hopefully to help improve some patient outcomes and maybe change the way you look at a few things in the office. So if you look at the title of this, Dysmetria of movement being there in quotation marks, this is going to be about mental health and how emotions and thoughts really tie into our movements and how we evaluate things. You know, as chiropractors and, physical therapists or doctors, we all work, with patients in different ways, but we all look at things or look at the patient at the same time, right? So what we're going to do is kind of uncover some things that we found out in working with different populations about how mental health is really showing up in the office. And this is something that's kind of been a project of mine for a while now. And it started looking at patients with concussive injuries or traumatic brain injuries. But now with where we're headed in our world today, with everything we've just gone through, and I'll show you guys some statistics here as we unravel this, the mental health epidemic is coming. So we'll kind of jump right in here. 40 minutes is not a long time to unravel a lot of things with mental health and brain, but we'll do our best to kind of give you some clinical pearls here as we go. So first, I like to start with this because this is the other side of the coin, right? If we can better understand what happiness is, I think it gets us to where depression and anxiety and those kind of things come from. So I love this statement just as a general, simple way of looking at happiness or mental health in general. So happiness is when reality is better than our expectations. And, we look at the areas of the brain or we look at the areas of the nervous system that are involved in both of those things, reality and expectations. And they are two very different parts of the brain, but two areas that have to be very good in their communication, very efficient in their communication, and really able to unravel together. So, looking very specifically at this, what is reality and where is that made up? When it comes down to it, our brain or our reality is a lot of things. It's conglomeration of all the sensory signals that we take in, whether it's through our eyes, through our muscles and our joints, about our joint position sense and things like that. You've got things like your vestibular system in the inner ear, all the touch receptors all over your body. They take in all of the sensory input that's coming into you. And then we take all that input and we've got to form what our opinion of the reality of our world is. Right? Well, there's another piece to that puzzle. Every past event, everything that's ever happened to you, all of your emotions, your memories, all of those things are going to overlay that sensory input, and they're going to determine what the lens is, so to speak, that you view the world with. There's a ton of quotes, whether you believe you can or you can't, you're right, you are what you see in the world, or all of those different things kind of give us a peek into that about how the neurophysiology of that works. Your opinion of what's going on changes the way you're viewing a certain situation going on, right? And I'm sure we've all had experiences where when we're having a really good day, everything just seems to kind of roll and go well, because you walk into the day with a little bit of happiness, you greet everybody in that way, and different doors open up for you, versus if we have a bad day or we're feeling really crappy when we roll out of bed, our world maybe puts up barriers that we can't overcome. So some of that is the lens with which we view the world is kind of our mood or our personality and where we're at. And that's what forms, that's all of our reality, right? It's what we're taking in or what we're viewing of what we're seeing going on around us. And then our expectations are what we expect out of that. So again, if you wake up and you're used to seeing crap all the time, you're going to have maybe crappy or lower expectations. But when these two things can sync up and you can really supersede this and reach beyond or have the confidence and the courage to reach outside and look at those things, you can get whatever you want. But when those things start to fall short, that's when we start to fall off a little bit. So when our brain isn't able to predict what's going to happen and then be able to compensate for that as well, when it's not efficient at doing those things, that's when we can start to have some depression or some mood changes. right? So we see it from both sides. Our reality can form our expectations, and then not meeting those expectations can change our reality. So it's this cycle that kind of continues to go around and around. And what we're realizing is brain health is at the kind of the core of this. And that's why I really, think it's an awesome time to be a chiropractor with everything that we're doing, especially with neurology and the brain and neuroscience and kind of where we're at with all of this stuff. Is the science is just, it's changing daily, and it's amazing. All of the research that's coming out, and the way we're changing our view on how the brain works and how our brain interacts with others and the environment. It's really cool time to be involved in all of this and to see how that is. Because as chiropractors, we're affecting a lot of these areas of the brain, and we'll kind of unravel that as we continue to go here. First, let's just start with some depression facts, and most of these are pre-COVID. So, over 18 million people report depression symptoms. It's the leading cause of disability in the age groups of 15 to 44. So this is something that's affecting everybody, whether people are talking about it or not. This is affecting you. Someone dies from suicide about every 13 minutes in this country, and that's a scary statistic. And most suicides that mostly comes from things like depression. And depression isn't even the #1 mental illness that's out there. Anxiety actually is the #1 reported one. But most people that have anxiety also report depression. Now, two kind of different areas of the brain, two different sides of the brain, if you will, for depression and anxiety. Anxiety is more that classically thought of as that more ramped up feeling, or kind of, running and running and running and not able to calm down or really relax. Whereas depression is that person, like this picture here with the girl, kind of looking out the window, very sad, very lethargic, more so. Anxiety classically associated with like that racing heart or getting all anxious and ramped up, whereas depression is more the wanting to stay in bed, sleeping through their alarm, and those kind of things. So two different parts of the brain, but the reality is when you talk to people about this, they have trouble discerning whether or not it's anxiety or depression, especially when you start to chat with patients. So we need to maybe do a better job of unraveling which one of these it is, because it helps to clue in some of the areas of the brain that we can work with. Now, this is something, like I said, we kind of came upon working with mental health on accident. And I think everybody else, we're going to start having that happen too. Whether you want to work with mental health or not, especially right now, it's going to start walking in your office. So, I mean, if you just look at these numbers, millions of people across the United States struggle with this. 18% of the United States struggles with anxiety on a daily basis. And now it's only getting worse with the coronavirus stuff. This stat is from the middle of the coronavirus, but more than half of the people who lost a job said they were suffering with mental health issues. But even 40% of the people that didn't lose a job or income were suffering from mental health problems as well. So even the people that didn't necessarily get affected economically, and we know now that we're kind of on the other side of all of this, the isolation and kind of putting people in a box, not the best thing for mental health. We're the type of animal or creature that needs interaction with others for our brains to be healthy. We need to have that social connection with people, and not necessarily in a 2D virtual world. We need it in a 3D environment where we actually get to be around each other, hang out, touching each other. Those are big things for our energy, for our brains, for our bodies, and for our nervous systems ultimately. I've always kind of described it like this. The Zoom meetings and the virtual, getting to hang out with people, it was okay to kind of get us through some things, but we need to return back to normal with that. It's like if you look at a postcard of a really beautiful landscape, you can probably imagine the smells and the sounds and all that kind of stuff. Let's say it's at the bottom of a mountain with a nice little lake at the bottom and a tree. And you can almost even picture yourself sitting there. That's a 2D experience. You can run through some different pathways in your brain. And like I said, you can even close your eyes and imagine that you're there. But, being in that environment is totally different. You get to hear everything for real. You actually get to smell the smells. You get to, experience the feel of the grass or the ground underneath you, and, see things at a depth that's different. The depth of involvement of your brain is greater with that 3D or 4D experience than it is, in that virtual environment, so to speak. So that's a big reason why I think a lot of people, 54% by these numbers had depression because they lost a job, but even 40% of the people that weren't affected also had some issues. And this kind of the newer numbers as far as anxiety and depressive disorder, 11% in 2019, all the way up to 41% in January of 2021. So this is the next epidemic or pandemic or whatever you want to say, especially as we start to have this not be as taboo of a subject, right? We're starting to understand that people need to be able to talk about this. Mental health isn't necessarily a weakness. It's something we need to start paying attention to. And we need to have better options, because right now, if you look at, this is actually an old article out of the Rolling Stone. If you look over Ed Sheeran's right shoulder where it says the Psychedelic Miracle, the drugs they created for depression and anxiety aren't much different than they were in the 1940s. So their options or their thoughts is, let's use ayahuasca, MDMA, psilocybin to treat mental illness, to treat things like depression, anxiety, and schizophrenia. So ayahuasca is a hallucinogenic cactus. MDMA is ecstasy, essentially, and psilocybin's magic mushrooms. They are running out of options, right? So we're basically starting to use in micro doses, right? Don't get me wrong, they're not taking people on a trip, but they're trying to microdose these people to help with their mental health, right? So that's their answer is, let's use street drugs and see if we can get there. But we're going to microdose it. Everyone I know that has been given that as a microdose just saves up their doses and uses them all on Saturday night. Seriously. So we're kind of giving people the ability to self-medicate or use street drugs now. And my experience has been they're using them the same way you would use them, recreationally, as opposed to using them for mental health.
Powerful presentation there from Dr. Longyear, and a really important topic. And these are the clinical topics that we strive to bring out and highlight in our Axis event, because we're all out there taking care of people. The lines between mental health and physical health have blurred, and we are all one. And the dynamics between those two are something all of us should be mindful of. And you probably have heard the opioid epidemic is a chronic pain epidemic, and all of these things, mental health ties right into that, because how we're feeling, kicking off with the mindset, how we're feeling can definitely manifest physically and vice versa. And we've always thought of these as two things interplaying to each other. However, I think as time goes on, we continue to discover and learn, Jason, that this is all one. What was your big takeaway from Dr. Longyear's presentation?
It's super valuable. I'm glad you chose to share this one this week. Mental health is affecting us, ourselves, our family members, people in our offices, people on our staff, on our team, let alone the people coming into your practice looking for help. And there is a connection between how we think and how we feel. There is a connection that allows this to start bringing the conversation about what chiropractic really is into the forefront. We work with the nerve system. We work, therefore, with the brain. Our emotions are connected to our brain function, our interference in our spine, all of that, motion, movement, lack of movement. These are just cycles that if we don't interfere with and adjust, realign, and get onto a positive path, will continue to spiral in the negative path that it continues to go. The only solution that really appears to be out there for most people most of the times is medication, which of course most of us would know isn't really a solution. And I just think it's a great topic and a great opportunity for us as a profession to grow, to expand, to communicate in more creative ways to really help more people with this issue. And in some cases, it may be as simple as their mental health concern is a byproduct of their chronic physical pain. That is one of the ways people certainly have mental health issues, and maybe one of the more popular ones. If you've ever lived in chronic pain yourself, it's no wonder that people do live with chronic pain as long as they do under the circumstances they do. It's miserable. So it may be one of the more popular reasons why people do have mental health issues, amongst many others. We have a perfect opportunity to be of more service to more people when we can communicate our truth and teach and invite people consistently about how their bodies work, how their brains work, how their minds are connected to their emotions, and what role they have and what opportunity you have to help them get where they want to go. So great topic, super important, probably never been more relevant. And I'm afraid it's going to get worse before it gets better, predicting the world the way I see it at the moment.
I agree with you there, Jason. Everybody listening and watching, this is a great topic to dive back into. Access 2021, you can access it via the Smart Chiropractor. So head on over to the Smart Chiropractor and be on the lookout for Access 2022. Coming up later this year, we'll have details. And a huge thank you to Dr. Longyear for a great presentation, a timely presentation, and something all of us as chiropractors and as people of the world should be mindful of. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.